The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, unique approaches used at the center. Your presenter, Chad Krier, ND, DC.
Well, a few of you made it out on a nice day. Everybody else golfing, huh? Let's see if I can get this to... Okay. Well, what the goal of this was just to kind of let you see some of the things that we do here at the center. Some of the different unique therapies that we offer. A lot of times people say, well, I didn't know you did this, or I didn't know you did that. So we want to kind of go through a little bit of what we do out here. And then if you have questions at the end, we'll take questions on all that stuff. So, well, basically, you know, the center, a lot of people kind of do wonder what we do out here. And it's, you know, what I think of the center, I think of using nature to get us back to health. And so when you think of the word physician, it's from the Greek root meaning nature. Yeah, so physician actually means nature. We've kind of gotten away from that lately, but Hippocrates did teach that nature is the healer of all diseases, or in the Latin phrase, vis medicatrix naturae. So, and if you think about that, if you put that in there, at some point they put physician is the healer of all diseases. If you think of physician as nature, but really, I don't think of doctors as being the healer of all diseases. It's the body has an incredible capability to heal itself, but we can utilize natural therapies to help it improve that way. So, if this was what Dr. Ron had told me several years ago when people would say, what do we try to do at the center with each new patient? And this was the answer Dr. Riordan gave. He said, we're attempting to characterize the biochemical uniqueness of each individual. So we're trying to understand the patient from the inside out and trying to understand what makes each individual unique. And by looking at their biochemistry, we can come up with some different parameters that make them unique. Just an overview for those who've never been here. What we generally do with new patients is they come out here, they will visit with us for 2 or 3 days, and the first time that they're out here, they'll meet with the doctor, sit down, the doctor does a thorough history. That generally takes about an hour. And then we do the lab evaluation, and that's where we're trying to really identify the biochemical uniqueness of each individual. So, and our laboratory testing is unique in that we look at nutrients, fatty acids, all kinds of different parameters in the blood. And then we do a physical exam, so that's another 45 minutes to an hour on top of meeting with the doctor. So really, one of the things that separates us here is we try to get to know the patient, try to get to know your what's going on with your family, what's going on in your social interactions, what your diet's about, and then really finding out what you're all about on the inside. So looking at your biochemistry. Okay. Well, the whole point of doing this, all these labs and looking into the biochemistry of the body is we're trying to identify the cellular and biochemical malnutrition that may be taking place inside of your cells. We know that we need certain things for our cells to run efficiently to give us fuel for our body, and if we're deficient in just one thing, it can create a chain reaction. If we're deficient in many things, then it creates a whole host of problems. So once we're able to find out what we're deficient in or what we have excesses in, we want to try to support the body's natural healing capabilities by giving the right molecules to balance the body. So we've termed this orthomolecular medicine. And ortho means right, molecular is molecules, so trying to use the right molecules to bring the body into balance. And basically you can say we're using natural molecules, so again, natural medicine, physician is nature. Well, I want to talk about some of the different things that we do out here, some of the different procedures, whether it be therapeutic or whether it be diagnostic tools. I want to just have a look at some of the different things that we do. So most patients when they come out here will have the chance to have auricular therapy done. We'll do something called biofeedback and biological age testing, and also nutritional counseling. With auricular therapy, basically this is just a non-invasive form of low-grade electrical current applied to the ear. And This was started probably in the late 40s to early 50s by a French medical doctor, Dr. Noget. And the reason he started this was he had a patient who had a lesion on his ear, and the patient wanted that lesion removed, basically just a mole. And when he removed that mole, the patient came back about a week later and said, "Hey, I don't know what you did to my ear, but the back pain I've had for several years went away." So he thought, well, maybe that's, it's probably just coincidence. But then he started removing lesions on ears, and pretty soon people were saying, pains are going away. He started to think, well, maybe there's some sort of connection between the ear and the rest of the body, and then all of a sudden he just delved into the research on that. And pretty soon he had a map on the ear that corresponded to the human body. And basically, if you think of the ear as an upside-down body with the head at the bottom and the feet at the top, we can send signals into the ear that go to the brain that then send signals to the rest of the body and get some effect, especially for relief of pain, just by treating the ear. So it's what it does for us is it gives us a way to actually map the ear, find out where there may be some imbalance at different points of the body by looking at the ear, and then actually applying some low-grade electricity to that part of the ear, and hopefully having an effect on the part of the body that corresponds to. So basically you just use an electrical device, and we scan the ear. The electrical device has two dull probes on the end of it that measure the electrical difference between two tiny points on the ear. Any area of higher resistance, meaning that there's some sort of electrical imbalance in that area, will give us a reading on the graph. If the reading is really far off, then that tells us there's some sort of imbalance in that area, and we generally treat that area. So when we do that, we just use low-grade electrical current, and we use different frequencies depending on the part of the ear that are treated. And this is just an example. So it's nothing, there's no needle stick involved, and it's just a dull probe to kind of scan the ear and then address the areas that are showing up. So can be really beneficial for pain. Mostly what I've used it for is pain control, pain management, pre-surgery pain control, and anxiety. So those are the biggies. Well, another thing we do out here is biofeedback, and the type of biofeedback that's largely used is called autogenics. So auto is self, and genics is just basically creation, so it's a self-creation. We used to think that our autonomic nervous system was completely out of our own control. Well, we now know that we can self-control our autonomic nervous system. We can be trained to do that. And so autogenics is a process that allows us to try to train our body to control things. And just some examples of autogenic training are when they teach you to relax certain parts of your body, make certain parts of your body feel heavy, then make them feel light. Try to make certain parts of your body feel warm. Try to make certain parts of your body feel cold. All these different things, those are a type of autogenics. You can also use hand thermometers where you try to warm up the hand thermometers. You can do oral thermometers. You can do heart rate monitors where you try to change your heart rate. You can do things with sound. But all these different things are autogenic. And the whole point of this autogenic process is trying to restore balance in your autonomic nervous system. Your autonomic nervous system has two dynamics. It has the parasympathetic and it has the sympathetic. So the parasympathetic calms things down. It's your rest and digest type of nervous system. The sympathetic speeds things up. It's your fight or flight, get up and go, run from the tiger type nervous system. So the whole goal with autogenic training is to hopefully put you in more of a parasympathetic rest, digest, healing mode and take you out of that sympathetic fight or flight, run from the tiger exercise mode. So it's a calming therapy. And really the whole goal there is parasympathetic. If we know somebody has poor digestion, we want to put you in parasympathetic mode. High blood pressure, we'd like to put you in parasympathetic mode. Heart arrhythmias, we want to try to put you in parasympathetic mode. If you have immune dysfunction, parasympathetic mode. So all these things that help balance your autonomic nervous system can be very healing to the body. And so autogenic training is just one aspect that helps to bring balance to the autonomic nervous system. Another thing we do out here that some patients really like and some patients really hate is the biological age testing. So we're looking at what your functional age is versus your actual age, your chronological age. So you may be 80, but your functional age may be 60. You may be 60, but your functional age may be 80. So hopefully your functional age is lower than your actual age. That's the goal. We know that quality of life depends on our ability to function. What good are we if we can't function as we get older? We all hope that as we get older we're able to have some sort of function. So this biological age testing just says, well, you're either heading up the right direction, or whoa, you need to back up and make some changes in your life because based on this test you're moving in the wrong direction. So we know that around 35 a lot of things can begin to decline. So what this biological age test does is it measures 12 parameters that are important for aging. So we look at things like memory, reaction times, hearing, visual sensations, lung testing, do vibratory sense to make sure your nerves are working well, and just speed of movement. And by looking at all those different biomarkers, those 12 different biomarkers, we can compare your scores to scores of people your own age or in your age category, and then we get your average, and we can compare your average to kind of a standard average and see if you perform at the average, above the average, or below the average. And what it does is it calculates your score on each of those 12 tests, and then it compares you on those 12 tests to people of your own age, and then you get a report that says, well, you're above or you're working below. So it kind of gives you an idea of things that you need to work on. And that's just an example of the computer that take the test on. Okay, so a big part of what we do out here is nutritional counseling. I'd say that's a huge factor. All patients who come out here are asked to fill out a 7-day diet diary. That gives us a lot of information that we can punch into a computer, basically all the foods that people wrote down for 7 days. We can punch that into a computer and then get a good idea of their macronutrient intake, their micronutrient intake. So macronutrients, the biggies that give us calories, carbohydrates, proteins, and fats. And then we can look at the micronutrients, the vitamins, minerals, amino acids, all those good things. Also tells us a little bit about their fiber intake, and just gives us a good idea of whether they're eating whole foods, foods that are intended for us to eat, found in nature, or if they're eating a good amount of processed foods. So that can be a good thing. And then a lot of people choose to do something called cytotoxic food testing, where we can actually measure food allergies or food sensitivities. Well, our whole thought process out here is that as far as diet goes, there may not be any right or wrong diet as long as you're choosing whole foods. Whole foods should be the basis of the diet, and those are foods that have not been processed or packaged down in any form or fashion. So again, our goal, identify and treat malnutrition early. If we can get you early before you're malnourished or before your vitamins are low, then that's ideal. Most of the time that doesn't happen, so we're going backwards. You're already in a nutrient deficient state. But working with the diet, again, we're trying to encourage whole foods, because these foods were once alive. We know that life is cellular, so eat foods that are somewhat living. And your cells, again, they require the whole nutrient team. So supplementing with just one particular vitamin, you may not be covering all your bases. There's lots of phytonutrients that are found in foods that we really can't put in pills. And foods found in nature come with an abundance of a biochemical team. So we're not just sending in the quarterback, we're sending in the whole team when you eat the whole foods. And the problem now, forever, in the standard American diet, or the SAD diet, is that it's all refined. It's basically the cupcake generation, where everything's made with white flour, sugar, and fat. So we don't want to sabotage ourselves by eating all that junk. We want to try to use the whole foods and make sure that we're getting all of those micronutrients from our foods. So this is just an example I like to use where if you were to take an orange, a good old nice orange, and if we look, we're looking at the wheel here, and the spokes start at the center, and they come all the way out to the edge, and there's another little wheel in here that you can't really see. But the further those spokes come out, that basically you can think of it as that's a more healthy food, because it's going to be a more nutrient complete food the further that these spikes come out. So if you look at an orange, we've got all the vitamins listed here, we've got all the amino acids, we've got all the minerals, and then the trace minerals. So if you were to eat an orange, it looks like a pretty healthy food, because look at all those spikes coming out on it. If we were to take that orange and turn it into orange juice, we start to see less spikes. This was pretty full earlier. Now we've taken out a lot of the pulp, and so all these amino acids start to disappear. So the food's becoming less whole. If you take that orange juice and turn it into orange drink, you see basically all those amino acids and fiber that was there earlier, those are basically gone. And now it's got some of these vitamins, but some of this vitamin C was added back in. The folate was probably added back in. So really it's becoming less whole. If you take that orange drink and turn it into orange soda, we basically don't have anything left. And if you look at what orange soda really is, basically looks the same as if you were to look at sugar. So taking something that was an orange, and then we think maybe we're doing something healthy when you drink orange soda. It's still got a healthy sounding name, but basically just doing sugar. So the whole point of this is when you take in whole foods, you get all of these nutrients that help you take those calories and turn them into energy. If you're taking these types of foods in, you're getting calories from those, but you're not getting any of the nutrients to help you process those calories. And so those nutrients have to come from somewhere. So where do they come from? They come from your tissue stores. So basically, you're robbing your body of nutrients to process all of those calories. That's how we become nutrient deficient over time, by not eating whole foods. So the goal, again, eat the whole foods. You're getting the nutrients on board. You're not going to rob your body's tissue stores of nutrients. And the overall factor there is you'll tend to be healthier. So, and that's what we promote here. The restaurant you just ate at, we're trying to use whole foods, your fruits and vegetables, pretty much every food group you can find out there. So you can definitely get plenty of fruits and vegetables here. Utilize an organic garden. So again, organic foods are not going to be full of pesticides or things, all these pesticides that they spray on foods to control for critters. The problem with those pesticides is that if we don't wash those off good, or if they get into the product that we're going to eat, those pesticides have to go somewhere when we ingest them, and most of them are fat soluble. So they tend to be stored in our fat soluble organs. And then the problem is all of our cell membranes are made up of fat. So if you take in pesticides that are stored in your fatty tissues and largely your fatty membranes, then they really muck up how your cellular receptors work. If you muck up the cell receptors, your cells can't communicate very well, and pretty soon your body becomes pretty confused, and that leads to illness. So the world's toxic. This is one thing you can do to decrease your toxic burden, is to try to eat whole foods that have not been doused in lots of chemicals. This is just an example of a food test that we do, the cytotoxic food testing. So another thing that we offer for people to really help their health is to avoid foods that create inflammation when you eat those. So these cytotoxic foods are rated based on their degree of inflammation that they create in your body, and you can grade those on a 0 to 4 scale. So the higher the number, the more reactive, the more inflammatory reaction that may be created in your body when you eat those. So this is something we counsel patients on, avoid these foods that you are reactive to. Okay, there's lots of other things we do here. So again, most patients come out here, they'll get a massage, we may do Kirlian photography, that's an option, or blue rock. So massage, the whole point of massage basically is it stimulates the circulation. We know that we live in a tense world, and the tighter your muscles get, the less blood flow they get. And the less blood flow they get, the tighter they get. And the tighter they get, the less blood flow. So most people we see have some sort of pain. And we know that pain can manifest just by having tight tissues, and tight tissues decrease your blood flow. no blood flow makes your tissues even tighter. Over time, your muscles aren't getting the oxygen that they need because the blood flow to those muscles is not being delivered. If your cells aren't getting enough blood flow and they're not getting enough oxygen, then pretty soon they start to go on anaerobic metabolism, which means all their energy process is derived, but it's not being derived with oxygen. And the problem with that is you start to build up all these noxious metabolites in your muscles, like lactic acid, you can get nitric oxide, all these things that create inflammation. And when all these little chemicals that build up in tight, tense muscles create inflammation, they stimulate your nerve endings and they constantly send signals to create pain. So the whole thing with massage is that it sends blood flow to those muscles. That's why some people say, oh, I feel so much better after a massage, but 2 or 3 days later, oh, it's back, because their blood flow is gone again because their tight, tense muscles come back. But over and over, if you can get the massage, the more the merrier, because you're stimulating that blood flow to those tissues. That blood flow brings oxygen. That oxygen helps those muscles relax, pushes out the lactic acid, decreases the pain receptors, decreases the chemicals that are sending signals to the pain receptors, and over time you start to feel better. So massage is just a great thing for delivering blood flow to the muscles. Well, another thing that's unique is Krier imaging studies. Kerlin was an electrician, and he discovered that he can take an electromagnetic field, so a magnetic field, and then he can pulse that magnetic field and put objects in it, and then he could get a picture of a discharge from those objects. And so what you get is this kind of photograph or this aura from these objects that are placed in this pulsed electromagnetic field. And really we don't know for sure, but we just kind of think of this as the energetics of the body, and we assume that the more energetic emissions that are coming out, the better. The more vibrant you are, the more energetic emissions we tend to see. So basically, all these you're putting an object in a pulsed electromagnetic field, and then what we see from that are the gas exchanges that are taking place, the electrical exchanges that are taking place. Those are giving off signals that we can see in a picture form. So the stronger the signal, the better. And Dr. Nina out here has basically developed this Krier photography into a method that uses acupuncture meridian points to the point where she can give us a kind of an understanding of where there may be some energy imbalance in different systems of the body. So this can kind of, I've seen it correlate quite a bit. And basically on these pictures here, just by putting your fingers in a pulse magnetic field, she computes that with Russian physics and tries to correlate that with acupuncture meridians. It's pretty fascinating. And then we can come up with areas of imbalance in the body. And you can see on this picture here that we're looking at the head, the eyes, the jaw, the tonsils, thyroid, etc. Well, this was a complete body aura or Krier photography, where they took patients and looked at them before treatment with auricular therapy that we talked about earlier, and then they took them after treatment. And so you can see that the energy patterns of the body, there's lots of breaks in here. They're not really vibrant. Then you come over here and you can see kind of just this full spectrum of emissions of gases that are coming off, and that was after therapy. So here, they might have had some sort of energy imbalance, and what they did was gave them an electrical therapy, basically an auricular therapy, that sent energy into the body and hopefully corrected some of the energy imbalances. And then we see this take place. So they looked at cases where they just did acupuncture on them before and after, and then they did acupuncture with electrical stimulation. So it looks like sending some electrical current actually does a better job than just needles alone. Okay, another thing. How many of you have done blue rock? So that's the little thing out over here that a lot of the patients do, and that's we talk about feel, hold, and release when you do blue rock. So the feel is Basically, some patients, we say you might want to take a marker down there with you, or just think about somebody's name that's giving you trouble, or a situation that's giving you trouble. And basically, we've got these clay pigeons or blue rocks, and the feel part of that is to kind of put your emotions into that rock, or to put the situation, write the situation that you're dealing with into the rock. Or if somebody's really driving you nuts, maybe just put their name on the rock. Hold on to that, and then release it, let it go. So we're sending it away from us. And just simple blue rocks or clay pigeons, and going out there, feel, hold, release. It can be, a lot of people just find it to be one of the best things they've done. So you can do it at home with your fine china. Works well. But that's definitely powerful. It's something unique that we offer out here, and it's a great way to relieve tension and bring blood flow to muscles, right? So other things, nutrient injections, nutritional therapy through IVs, IV chelation, hyperbaric oxygen therapy. We're going to talk about Heidelberg Testing, Nasosympatico, and a trigger point reflex injection. So we'll try to get through all these. So these are some of the unique things that we do as far as actually delivering therapies through needles. So intravenous and intramuscular, we can either put needles in the veins or we can put them in the muscles. And the whole point of this is to achieve levels of nutrients above and beyond what you could ever do on your own, taking them through food or through oral supplementation. Whenever you eat food or you take supplements, those things have to be swallowed. They have to go through a whole rigmarole in your digestive tract, and then hopefully what you've taken in, hopefully 70 to 80% will be absorbed, but your body can only absorb so much. We can bypass that whole digestive route by sticking the nutrients or the minerals or whatever we want to put in there into the muscle or directly into the vein. That way, pretty much whatever's in the vial that we're giving you, your tissues are guaranteed to get. So we're bypassing your digestive tract. We know that a lot of the times when you look at nutrients, people will say, well, those nutrients don't work. Well, yeah, they work. You've got to get them to the right concentration. So that's why the lab's helpful. We need to know your blood levels, and a lot of the times you can take a supplement. May not do anything for you if it's not building up. It may be because you have a digestive imbalance, maybe just because you have a genetic requirement for more of a particular vitamin mineral that you could ever get from just food alone. So the IV and IM injections can be very good for getting ideal serum concentrations to have pharmacological effects from nutrients, basically. So again, what are we trying to do here? Trying to optimize your cellular level of nutrients. We do that to overcome any biochemical weaknesses or genetic challenges that you may have, and hopefully turn on your cellular machinery. That's just an example of an IV. So kind of claim to fame is IV vitamin C. Vitamin C does a lot of different things. It's one of the best vitamins around. I mean, it's a natural antiviral agent. It's an immune stimulant. Some people say it stimulates your immune system in 12 different ways. I've read some that say 24 different ways. So it stimulates your immune system. It provides connective tissue support. It's one of those things that helps basically turn on your proteins so that they can help you build connective tissue. There was a study, can't remember when, it was way back in the 30s or 40s, where they looked at rheumatoid arthritis patients and giving them vitamin C, and they were having dramatic results. So the whole reason there was with arthritis, it's a connective tissue weakness, and a lot of those patients probably were at scurvy levels of vitamin C, and by giving them vitamin C, it really corrected their connective tissue. It's a natural antihistamine that some say you can deplete your histamine stores by 70% just by taking IV vitamin C. So it's if you have allergies, you may want to consider really taking lots of vitamin C. It's an anti-inflammatory, so one of the things when we give IV vitamin C, one of the things we often hear is that pain levels decrease in patients who are having pain. We do that. Vitamin C works as a natural anti-inflammatory, so it will help to decrease pain levels. It's an antioxidant, so again, stops free radicals, again, anti-inflammatory. And then high dosage vitamin C can be cytotoxic to tumor cells or cancer cells. And we'll go through some quick reasons on that. Just real simple here. Tumor cells really like glucose, and vitamin C is just a few hydrogen molecules away from looking like glucose. Tumor cells, cancer cells, have lots of glucose receptors on them, and vitamin C, because it looks very similar to glucose, can be readily taken up into those tumor cells. Now, tumor cells or cancer cells lack an enzyme that breaks down hydrogen peroxide, and when we give vitamin C in high concentrations, it can actually create hydrogen peroxide. The hydrogen peroxide can build up in the tumor cells, and that's cell killing. So that's just a simplified mechanism of how the IVC is affecting cancer cells, but it can be a good thing there. What do we use vitamin C for? Any types of infections. Again, it's an immune stimulant. You can do it for pain because it's a natural anti-inflammatory. You can use it during allergy season, like right now, because it's a great antihistamine. So just a lot of different indications to use vitamin C. Well, Myers cocktail. Myers cocktail is kind of a variant. It does have vitamin C in it, but this is another IV that we can put. And basically this one is just kind of throw in the kitchen sink. We give you the B vitamins, some minerals like magnesium, extra doses of certain B vitamins, and then vitamin C. So again, we're trying to turn on the cellular machinery, and we're doing that by superloading with all these nutrients. Now this one, different type, in the Myers we can tweak depending on your condition. We can add more magnesium if you have headaches or asthma or muscle aches. You can add calcium or zinc. Calcium if you're having cramps. You can add zinc if you have colds. So you can really kind of play with this, but it does, indications are numerous, but asthma, migraine headaches, fatigues, muscle spasm, allergies, all kinds of different things. And again, if you have any sort of GI disturbance, so irritable bowel, inflammatory bowel disease, you may need some IVs just to try to get your nutrient levels up because your GI tract is not allowing you to handle food well. Well, chelation. What's chelate mean? Go ahead.
Doesn't it mean to attach to an amino acid?
Yeah, chelate is to bind onto and claw. She had it. She had the claw up. So bind onto and claw onto something. And so with chelation, what we're trying to do is bind onto something that hopefully doesn't belong in our body and try to pull that out. Now, the problem with chelation is that chelation is really, it's nonspecific, at least the chelating agents that we know of now. And so the chelating agents will bind onto not only the things we don't want in our body, but it will bind onto the good things. And so whenever you do chelation, you have to make sure that you replace the good things as well, while we're trying to get rid of the bad things. So really the goal with IV chelation is we're trying to improve circulation. And we can use a chelating agent, and that chelating agent that we use is EDTA. We also use magnesium, vitamin C, and B vitamins in an IV when we do the chelation. Generally, we're talking about doing that weekly, a weekly dose of the chelation for 20 or 30 weeks. Now, the whole point of this is that it will bind or claw onto toxic metals, and the goal is to try to remove lead, cadmium, or aluminum out of the body. And we know that the problem with these heavy metals, not only do they displace our friendly minerals, so they may displace our calcium, magnesium, all those good things. They muck up how our cell receptors work. They create inflammation in our body. They may lead to more oxidation of our cholesterol, and it's oxidized cholesterol that leads to plaque formation in the arteries. So removing these toxic metals may be a benefit for several reasons. One, it decreases oxidation of cholesterol. Two is it decreases inflammation. Three is that it allows our body to utilize our friendly minerals and not displace our friendly minerals. So it has a lot of good things, but basically we think of it as taking the stiffness out of the arteries. So you're removing an irritant to the arteries and hopefully improving circulation for doing this. So There's a book called Bypassing Bypass where they talk about using chelation basically to try to improve blood flow in your heart and in the arteries in general. Okay, hyperbaric oxygen. So this is another therapy that we offer. Hyper means more of, or above, or beyond, and baric is pressure. So this is pressure above and beyond what we normally experience on our day-to-day basis. So, and then the oxygen, we're talking about using high amounts of oxygen and giving this above and beyond atmospheric pressure. So generally you give a pressure that's above and beyond 1 atmosphere, 2 atmospheres, or up to 3 atmospheres of pressure. So again, with this, you're using oxygen under pressure, and basically the patient is in a tank. Let's see if we have. So they basically go in a pressurized tank, and we deliver oxygen under pressure, and that pressure forces the oxygen into the tissues. Normally, oxygen travels through what route? It travels just through our blood. And so our blood cells, our red blood cells, whenever we breathe in, the oxygen comes into our lungs, and then that oxygen gets pushed into our arteries and onto our blood cells, and our red blood cells have to carry that oxygen and deliver it. If we're anemic or we're not able to make enough red blood cells, that can be a problem because we're not able to deliver our oxygen to our tissues like we need to. If we have areas of poor circulation, diabetes, things of that sort, then we're not able to deliver our oxygen to tissues as readily either. So areas where there's been an infarct or stroke, or you've had a artery blockage, you may not be able to deliver your oxygen to those particular areas as well either. The whole point with this oxygen under pressure is that we can force the body to take in the oxygen. So not only will the oxygen be carried in our red blood cells, it'll just be pushed into our tissues in general, and basically we can saturate all of our tissues with oxygen. Now, why would that be important? We know that, again, oxygen is what fuels our body. Without oxygen, we really can't make our energy nutrient ATP, and without making the energy nutrients, our tissues just don't run very well. So hyperbaric oxygen is a way to help with the energy production in the cells of the body. So some of the indications that they've used hyperbaric for listed here: anything that affects the brain. If your brain really runs on oxygen, your brain requires more energy than most organs. So anything that affects the brain, this hyperbaric oxygen can be very beneficial. Fibromyalgia, chronic fatigue, Parkinson's, neuropathies, traumatic brain injuries, wounds that won't heal. If you have anaerobic bacteria in a wound, you can force oxygen into the area to help with that. So. Okay, Heidelberg testing. We're just going to keep going through here. That's testing can be beneficial for people who've had stomach issues and are trying to figure out what may be going on. This is a measuring device where we can see what your stomach is actually doing functionally. And we know that to digest food, your stomach needs to make enough stomach acid so that you can initiate digestion. If you're not making enough stomach acid, you may have problems every time you eat with maldigestion things because you're just not breaking down your food well. So if you're making too much stomach acid, you can have a lot of problems also. So this is a way of basically measuring the pH or the acid level in your stomach. And then what you do is you basically swallow this capsule, and it's tethered to a string. You swallow this pH capsule, it goes into your stomach, and then we get a reading. We get a pH reading of what acid level your stomach's at. Once we get a reading, then we challenge you, and we challenge you with a bicarbonate mixture or an alkaline mixture, and then we see if your stomach is able to overcome that challenge and make enough acid to actually digest something. So we know that basically a normal person, a normal young healthy control, will acidify after they eat a food or after they've had a challenge. Their stomach should make enough acid to overcome that challenge within 20 or 22 minutes. Anywhere from 13 to 30 minutes is normal. But if we do this test and you don't make enough stomach acid within 30 minutes, then we'd say you're hypoacidic. That means your stomach could use some help making stomach acid. If you make too much stomach acid, or your pH goes down within 13 minutes, then that means you're hyperacidic and you're making too much stomach acid. And so that can create a lot of problems. This is just a little capsule that's swallowed, and then this is, he's wearing a transmitter. Basically, the capsule that is swallowed sends a signal to the transmitter, and then the transmitter sends a signal to the computer, and we're able to graph out the pH. And so basically, patient swallows a capsule. Here is where we finally got the reading, and we're looking at the pH. The lower the pH, the more acidic. The higher the pH, the more alkaline. Your stomach should be more acidic. If it's too alkaline, then you're not going to digest your foods well. So come across here, and the stomach is more acidic when they finally swallowed it. We give them a challenge of alkaline mixture. When you take an alkaline mixture, your pH should go up, because the more alkaline it is, the higher the pH number. Well, your cells in your stomach should be able to make enough acid to overcome this challenge. And so eventually we see that, yes, the stomach made enough acid, the challenge was overcome, and now we're back into the acidic range. So that's not enough. We want to make sure that as you continue to eat, your stomach is still able to continue to make enough acid, so we challenge again. We give another alkaline mixture. This time we give the alkaline mixture and wait to see if the stomach is going to overcome it and become acidic, and in this particular case it never does. That line just kept on going. It didn't come out for some reason. So what this person had was functional hypochlorhydria, meaning that as they were to eat their meal, their stomach cells kind of quit on them, and they weren't able to make enough stomach acid. And so if they're not able to make enough stomach acid, then what happens is they dump their food early. The trigger for the opening of your stomach into your intestines is that the higher the pH level gets, your stomach starts to open and you'll dump that food. So as they were eating, they just dumped their food into their intestines before it's been churned and digested properly in their stomach, and so that's going to create a lot of bowel problems. So just doing this simple test would let this person know that, well, you don't make enough stomach acid, you could just take some stomach acid and you may feel better. So that's just a simple test you can do. On the flip side, if they have too much stomach acid, the signal for them to dump their food really doesn't take place very well, and so the food just sits in their stomach. Because it's not going into their intestines, that food is not being absorbed very well. Their blood sugars will often become low or tend to be hypoglycemic, and they'll be hungry. But then when they go to eat, they can't eat much. They're full right away because there's already food in their stomach. So that tends to be the flip side with too much stomach acid. Something else, so I'm just going to go on here. Something else we do, something called Nasosympatico. And that's something to do for sinusitis or allergies. And this basically involves using sinus pressure techniques, so specific pressure points on the head, along with certain cranial manipulation and lymphatic drainage to try to help the sinuses drain better. At the same time, we paint something called bitter orange essential oil into the mouth. The bitter orange oil is antimicrobial. It helps to dilate tissues, and so we use that to try to kill off anything that may be in the throat. And then we use nasal applicators, usually a series of 3 applicators in each nose, dipped into essential oils, and then we apply those into each nasal meatus, and we leave those in for about 20 minutes. Once we have applicators, so 3 nasal applicators in each nose, then we put diathermy, which is a deep heating device. We put that over the sinuses and basically cook you for a while. So this can be a good technique to use for congestion in the sinuses. It can work if you've had allergies that are irritating your sinuses or that are causing your nasal mucosa to swell. And this is something that's not really a quick fix, but in general, if you do 4 to 5 of those, you tend to do better. Now, why would we use essential oils and put those into the nose? Basically, because they're irritating. When you irritate something, it makes it angry. And when we make something angry, it tends to produce a lot of secretions. And so the whole goal of this is just to try to get that inflammatory reaction over and done with on a quicker basis. So we stick these essential oils into the nose. It irritates the little nerve cell mass that's found behind the nose. It's called the sphingopalatine ganglion. And it's the nerve cell mass that controls your mucus excretions. So we irritate the heck out of that little guy, and he starts to produce massive excretions. And those excretions, the whole goal is that they flush the sinuses out, flush the nose out, and promote drainage. And so basically we just dip these little nasal applicators into the essential oils, and then we stick them into the nose. So you too can be a star. You can see he's crying like a baby already. But basically, you put those things into the nose, and you cannot help the tear mechanisms. It causes excessive lacrimation out of the eyes, so we're trying to stimulate the tear ducts. The two ways that allergies or infections basically enter our body is through our eyes and through our nose. So we either breathe it in, or it comes in through our, those pollens come into our eyes, and then they drain down our nasolacrimal duct and then get into our throat. So the tearing can help wash that out, and then having an irritant in the nose, basically all those essential oils are volatile, and any volatile oil basically will rise, especially when heat is applied to it. And so we put those essential oils into the nose and then apply a deep heating source over that, and that sends those volatile oils into the sinuses, into the frontal sinuses, and into the maxillary sinuses. And those oils are, beyond being irritants, the particular botanical essential oils that we use are antimicrobial and antifungal, and so we're trying to drive those into the sinuses by using a deep heating device. And then we basically leave that on for 20 minutes. So that's something else that we do here. Another thing, the Infraspinatous respiratory reflex injection, or ISRR. This was a doctor who was doing a lot of trigger point injections, and he started to notice that some of his patients would report that after getting a certain trigger point injection, their asthma symptoms improved. And so he kind of traced it down to finding that it was this one particular trigger point found just under your shoulder blade where your infraspinatus muscle is. And he found that, if he could inject that particular trigger point, then the patient's bronchial irritation or bronchial spasm would be released. Their airways would open up. Their airways would relax much better. And so there seems to be some sort of reflex between this infraspinatus muscle on your back and your bronchial airways. And just by even just doing pressure point therapy on that particular muscle can really help the airways relax. And he noticed, basically any form of bronchial inflammation, whether it's bronchitis or asthma, anything associated with a tender spot in that infraspinatus muscle behind the shoulder blade. And sure enough, when people if they have pneumonia or bronchitis, or if they do have asthma, you can pretty much always find one of those trigger points on their back. So it can be very, very helpful. And this technique, the only negative here is that you are using a needle, but it's well tolerated, pretty much painless, and it's safe. We're sticking a needle in your back, but your shoulder blade is protecting us from poking it through your lungs, so it's pretty safe there. And you just use a little bit of a painkiller and a little bit of an anti-inflammatory. Try to find the right trigger point, put that in, and a lot of patients notice an immediate relief in their asthma symptoms. My wife had pneumonia 2 summers ago for about 3 months, just could not shake it, and I finally had Dr. Ron inject her in each of those infraspinatus points, and within about a week she had recovered. Now, we were doing lots of other things, but she'd had this for 3 months, and we finally got those bronchioles to open up, and then she was able to discharge things. Same thing with my daughter, went into an asthma episode, and normally I could adjust her and do pressure points on her infraspinatous muscle, and that would be fine, but she went into an episode that we couldn't help and just had him do these injections for us, and just after one injection, she's been fine since. That's been probably almost 3 years ago. So and we've got a lot of people who come in and get these on a regular basis to just say, this will get better than taking a bronchodilator all the time, and it tends to get them by for quite a while. So basically you just stick, there's the infraspinatous muscle, and we're just sticking a little bit of lidocaine, a little bit of anti-inflammatory right into the trigger point that we can find in that infraspinatous muscle, and we angle it around up and down and just kind of inject around in that muscle. So you take different angles, and within seconds to minutes you just really notice relief in those airways. So this to me is almost a miracle treatment for asthma. It can be really beneficial. Now some people, initially you may have to do that every 2 weeks to control things, but after a while it tends to taper down. Okay, well, we're about out of time, so I'm going to just end there and then take any questions you may have on any of the things we talked about. They'll come around with a microphone. There, okay.
Yes, the Nasosympatico, I think you called it.
Uh-huh.
I had a treatment many years ago from my family doctor, and he used silver nitrate. I looked pretty much like the man in the pictures, except he burned the sinus cavities open with silver nitrate, and it was very effective. But if I talk to doctors here about it, they just laugh and move away. Do you use that treatment also?
I've never used the silver nitrate before. I haven't even actually heard of that, but I'd be interested in looking into that.
I'd be interested in having it.
Okay. Any other questions? Up over here.
My doctor used arginine on those nasal sticks.
Oh, like what kind of arginine?
I don't know.
Just in a liquid form, or do you remember?
I don't remember. It's been so long ago.
Okay, I don't know how they... Well, arginine's a vasodilator. It makes nitric oxide, and so it helps to dilate things. So that's a good idea. I'll have to look into that, too. Try it out on Rebecca first.
No, I was curious about the auricular therapy.
Mm-hmm.
Does that work on sciatic nerve pain?
It can. I've had a lot of people who have done it with sciatica. It doesn't really cure it, but it will take the pain away. And for some people with that auricular therapy, I'd say, I do it on probably half of the new patients. And out of those, probably it works for pain control about 60% of the time.
About how long does it last?
And that's another thing, is for certain people it lasts 2 to 3 days. Some people it's 2 weeks. I've got one lady who comes in every 6 months, said arthritis in her hand stays away as long as she comes back twice a year. So it's just variable. And then for some people it doesn't work, but for a great 60% I say it does. But it's variable. Generally you might have to do it more frequently at first, and then it will tend to last longer.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.